here in Alameda County, we've declared a state of emergency. We have a policy where we take reports from all of our citizens on each call for service. Now, we're having that done over the telephone. So we'll have our units respond, see the people out front, say, hey, can we talk to you outside? Or is there a way we could talk to you over the phone? So if we can take phone reporting, we're doing that once again to try to limit that close contact. All of our people have been screened. People with symptoms are told to go home. Anybody not feeling well is told to stay home sick, and we're testing those that we can. We do that with our personnel. Each in custody person that comes through our jail, we're doing that outside of our facility. Then they get treated and observed by medical staff outside before they're even allowed inside our facility.
In the past week, we're taking extra precautions. Everything from as soon as we get here, we wash our hands before we enter the building, to when we come out, we're sanitizing our cars, sanitizing our duty belts. When we're going out to the public, we're constantly washing our hands, make sure we wear gloves, keeping our distance from the communities at least 6 feet. Even Sheriff's Dispatch is taking, their extra precautions. Anytime they take calls with someone, they'll ask some follow-up questions. You're feeling sick, illnesses. And if possible, what we're doing is we're taking reports over the phone if it allows us to. We were detailed to a call for service. We were exposed to an elderly woman who had flu-like symptoms, and we didn't find this out until we were already with her. But then taking those extra steps to clearing my partners, if allowed to keep myself in that room with her since I was already exposed, and then having our partners go get gloves, face mask, and then putting that on. And what we're doing also is we're relaying that information to paramedics, fire. In that case, paramedics had to respond. So I was able to relay that message through radio, and they were able, when they responded, to have the precautionary measures, the PPE, to safely handle the subject.
The officers drive patrol cars and share equipment. We have to be concerned about transmitting germs and viruses in those small confined areas. So we're cleaning all of our patrol vehicles. We're wiping down all the steering wheels. We have mobile data terminals that have to be cleaned because they're shared within the vehicle. So officers are required to clean before use and after use. We're also trying to limit the number of people coming into our public stations. We meet them outside. Our normal routine is we have our number of officers up to 40 in a room to get their daily briefings. We no longer do that in a confined space. We're doing the briefings outside, weather permitting. If it can't be done weather permitting, we'll transmit the information through our normal text messaging or emails.
I wouldn't say we're considered at risk because of what we did as soon as we found out. Luckily, we never actually went hands-on with the subject. But we are told, if you are feeling flu-like symptoms, if you're feeling any kind of illnesses, let a supervisor know. Maybe don't come to work. Well, don't come to work, and then doing what you can after you're done with that call for service. It is a little stressful, sure. So at home, we're quarantining. We're doing our part to stay out of the public, along with my parents. But ultimately, we have a job to do. I know what I signed up to do. I take pride in what I do. So when I get home, as long as I'm taking those steps to limit the exposure to my kids, I have young children, again, my parents, try not to see them as much as I do, maybe talking to them on the phone more, and on my days off, obviously make sure everything's sanitary, and then going and spending that time with them at home, which is essential to coming back, being in good spirit, and being able to carry on with the stress that we face every day.
Well, first responders and specifically our deputy sheriffs are very concerned about the effects of the virus. They're exposed because they're first responders. They direct contact with individuals they arrest, people that need, people medical needs. It's a very concerning time for our people.